Right, and nurses under the Universal Health Coverage UHC program who are currently on strike have called on county governments to pressure the national government to absorb them and employ them permanently. The nurses have been on strike across the country, with today marking their 17th day in the streets. KMPDU Secretary General govt has called on the government to resolve the intern doctors' wage crisis, a warning of a possible doctors' strike if the matter is not addressed.
The Universal Health Coverage Program nurses strike has marked its 17th day today. Nurses under the UHC program from Kirinyaga County led others from different parts of the country in the strike, occupying Kutu's town today with a list of demands. With their grievances addressed to both the county government and the national government, the nurses claim that their colleagues who had been employed on contracts and placed in hospital under the national government have been absorbed to permanent and pensionable jobs.
Employed in 2020 under the UHC program, and were put on a contract of 3 years. After the 3 years, the Council of Governors met and decided to extend for a further term of 3 years. However, when PSC went and sat down, they said that an extension of 3 years would be contravening so many laws under the labor laws, and so they recommended an extension of 1 year, after which we were supposed to be absorbed. But again now, after the 1 year lapsed in 2024, Council of Governors again decided that they cannot extend, so we were given another 2 years, which should end next year. However, last year, those who were posted in the national facilities were absorbed, and those seconded in the county were left out, which is discrimination.
The nurses now also want permanent and pensionable jobs, similar to their colleagues in the hospitals under the national government.
We are here demanding that we need our permanent and pensionable terms. We also need our salaries to be harmonized per the SLC laws, because now there are only few reasons why somebody should be put on contract, that is short term or people who have aged. If you look behind me, these people are very young. They are very young, so they are not supposed to be on contract. And again, UHC is not a short-term thing, it's a long-term thing.
The healthcare providers have called on the county governments to pressure the national government to meet their demands, vowing not to return to work until their demands are met.
So we are here to demand, if counties are benefiting from our work, then why shouldn't they push the national government to absorb us? Because now, if we work at the county level and they are saying we are not their employees, then who is benefiting from the services that we are giving?
In other news, the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU Secretary General govt has given the government a 30-day ultimatum to address the wage bill crisis affecting intern doctors, or else there shall be a doctor strike. Blue Smile Hassan, KUTV.